Hello everyone. Now we are going to discuss about augmented reality in surgery and healthcare system. So nowadays, augmented reality and virtual reality become the most exciting technology around us. AR is extensively used in entertainment, education and training, military training, and more importantly in medical and healthcare services like surgery, medical therapy, and so on. So this is an example of ear surgery system, and in ear surgery system, basically the surgeons are guided with a visual system based on augmented reality, and you can also explore some other system by using this links. So now uh, let's see what how an augmented reality assisted surgery system works. So basically, an augmented reality assisted surgery system is a surgical tool and that utilizes the technology by superimposing a computer generated image on a surgeon's view of operative field. And it provides a composite view for the surgeon of a patient, right? With computer generated visual things. And from this, a surgeon can experience how to perform the operation and what is going on and what to do next. And the surgeon can also locate the organs of the body where needs to be operated. And the surgical augmented reality system also can be used for training and preparation for operations or performance of an operation, right? So this kind of augmented reality based surgery system helps doctors performing better in operation. So this system can be performed using a wide array of technology. So like optical head mounted display such as Google Glass, HoloLens, HTC Vive, and so on. And this kind of technology, I mean the augmented reality assisted surgery technology, have been primarily tested in urological and cardiovascular domains. So AR may assist cardiovascular perform complex procedure, right? So how? The picture shows an overview of an operating, yes, the operation theater where a doctor is operating with the help of AR assisted surgery system. And in this figure, we can see, and especially a specialist is mapping the view of the operative field and the activity performed by the surgeon. Okay, so the augmented reality surgery headsets actually featured like a surgery view with augmented virtual patient and operating tool information, and the choice of using glass-free or autostereoscopic 3D display monitor that positioned directly in front of the surgeon, as well as viewing the surgery through a microscopic system like virtual reality, headsets, workstation, position on the robotic arm, as shown in figure here. And 3D holographic visualization of scar was performed to assist the assessment of complex 3 scar architecture. The figure shows that, right, here. And we can also see in the holographic visualization of a scar, yeah, in this figure. An operator and mapping scientist viewed the holographic 3D scar during electrophysiological study. Okay, so as we seen in the previous figure, and the user could intensively or interactively explore the 3D myocardial scar in the augmented reality environment as well. So Augmetics launches fast air spine surgery guidance system, right? And that system allows surgeon to visualize anatomy of the spine in real time. By using HoloLens 2 augmented reality system, a doctor and a surgical team can operate in a guided way very efficiently in the operating room. Actually, Microsoft augmented reality is slow, but it is definite to operate things, and there will be a less chance of making mistake. And entering the operating rooms in many hospitals around the world, the augmented reality operation surgery system actually utilized to help surgeons or doctors or the operating team during the operation for more accurate, more precise operations. Augmented reality is also used in therapy, physical therapy, right? And the Philips and Microsoft jointly developed a system for physical therapy. And in figure, we can see such a system for physical therapy. The HoloLens 2 supports multiple interaction like gesture recognition, voice control, eye tracking, and so on. And the HoloLens software also supports the cooperative working by letting each component in the team to see the same image. And we can see that in figure, right? Since the augmented reality assisted surgery system helps doctors a lot to perform the operation more precisely and more successfully, but there are some limitations as well, and the limitations are as follows. The absolute role and indications for air in surgery are yet to be established, right? So their absence right now, it need to be improved in the VR surgery system. And the data so far generated in air are not substantial. And there is another universal problem for any surgeon in the air environment, and that is the organ interest doesn't behave as expected because, you know, the human organs are not rigid, but it deforms according to the rhythms of heartbeat and respiration, right? According to the pressure during laparoscopic uh, in insufflation, right? So whenever the doctor operate with the laparoscopic setup, it also will not be the rigid. There will be something. Okay, so these are the basically limitations of an augmented reality assisted surgery for healthcare system. So they need to be improved or solved. Thank you.